One of the most important things we can take care of every day of the year is our skin, and perhaps we, like everybody, we kind of put it on the back burner during the winter months, but not so now. 'Tis the season. I want you to meet an outstanding, he's a surgeon, Dr. Robert Skaggs. He's with the Kentucky Skin Cancer Center. Doctor, it's good to have you. We want to talk about just preparing, a lot of people going on spring break, or just, hey, I want to get out, I'm going to be in the sun. What are the keys to making sure we have a safe spring and summer?
Well, thanks for having me. It's always important to protect our skin, but especially now as we're getting into the more fun in the sun time of year. We need to wear sunscreen every day. I tell my patients they need to wear sunscreen SPF 30 or higher to protect yourself from the sun and to reapply every couple of hours.
Gotcha. But we were also talking beforehand, physical preparedness, clothing makes a difference, huh?
Absolutely. I like big hats, sun shirts. Those things are better than sunscreens. Actually, physical protection is your best protection from the sun. Seek shade whenever it's really intense, but when you can't do that, sunscreen works very well.
And in this age of coming out of COVID, our lives have been turned around. Sometimes we forget very important things that we should do quite often, such as getting a skincare exam. Terribly important. Why?
Oh, absolutely. It's very important every year to have your skin examined by a dermatologist because we all have things we can't see. How do you check your back? You need a mirror or a loved one to do that, or your dermatologist. Your dermatologist is going to be able to tell you if that spot that you thought was okay is or isn't. And a lot of times we can give people reassurance, but sometimes we get to find cancers when they're early and when it's more easily treated. And that's a win for the patient.
You mentioned early skin cancer or skin problems, they start at a very early age, like with kids, right?
Yes, sir, absolutely. We treat kids, we treat 1-year-olds and 100-year-olds, and everybody has different things going on, whether it's eczema as a child, but sun protection as a young person impacts our later years. And most of the skin cancers we develop come from the times whenever we didn't protect our skin in our 20s and 30s.
You mentioned earlier, Doctor, SP 30, but some people might need SP 70 or higher. How do you know which you need?
Absolutely, that's a great question I get all the time. 100 is better than 50 and 50 is better than 30. But you should find the one that you like. If you're a patient that's had multiple skin cancers or melanoma, I usually recommend 50, 70, 100. Those are better protectors. They give you more protection from the sun. But whatever you like that's over 30 is great.
Just make sure you use it, right?
Yes, sir. You have to use it.
Real quick, Robert, what's the most common mistake we all make, the average person, when it comes to our skin?
So the thing that I notice the most is we're great at protecting our face from the sun, but the back of the hands, and those are places where we show our age sometimes. We get brown spots there sooner, and lots of people develop skin cancers there because they fail to protect their hands from the sun.
Great information. Dr. Robert Skaggs, again, he's with the Kentucky Skin Cancer Center. What's your website?
Our website is KentuckySkinCancerCenter.com. And our phone number is 270-842-1999.
Doctor, thanks for coming in.
Thank you, sir.
You're welcome. And we'll be back with more from Power Swabs. We'll take a look at your teeth right after this.